Five remedies from Nash therapeutics. Yesterday we discussed the first five remedies mentioned in the Nash, and I want all homeopaths to learn the remedies in relationship to one another and not because they are serially mentioned in the textbook in an alphabetical order or for any other reason. The moment you change your focus to study the related remedies and not alphabetical, that moment itself you are adopting to homeopathic principles. So, my dear homeopaths, my dear friends, I urge every one of you to study the materia medica and the remedies in relation to each other rather than in an alphabetical order. And it's going to be of immense help, practical help, rather than doing just a monotonous study that we used to do in college for our BHMS or whatever degree we are taking for homeopathic graduation in other countries. So we discussed five interesting remedies yesterday, the first five remedies which Nash has mentioned. And it's interesting to note we also covered the preface of Nash Therapeutics. And what did he say? It's all there out in the book as well as in the video. You can go through it. We discussed Nux vomica, we discussed pulsatilla, we discussed bryonia, and we discussed about the other two polycrest remedies after Nux and pulsatilla and bryonia, which is antimcrude and mercsol. And today we'll discuss the next few remedies which are in continuation of the previous remedies, which is the mercurius. So there are three mercurius compounds which Nash mentions, and it is important to note that these are the remedies that Nash have used frequently in lot of epidemics, in lot of critical conditions. Once you are aware of this, it's going to make your job easier to prescribe in acute condition. If you give results in acutes, you are with the patient for lifelong. One acute case result, 100 patients will come. One chronic case patient improvement or cure will take 6 months, 8 months, 1 year, 2 year, 5 years. You never know, but you give result in acutes in few hours, in few days. You have that patient's trust with you for a long time, and that's what Nash is all about. In his therapeutics, he shares about not only the remedies but the philosophy, the potency, the reputation, the cases from other homeopaths that he saw, that he heard, that he read. That's what makes it interesting. Today's remedy, the first remedy, for those who are watching on YouTube and those who are seeing on YouTube, they can see the PowerPoint as well. You can find out the channel with my name, or you can find out in Instagram. It's just me talking, but it's always good to have the speaker also hear him say. So today's the remedy will be Merc Core, which is the continuation of the Merc Sol remedy that we discussed yesterday. And for Merc Core, it is mentioned that Merck corrosivus is the remedy. So Merck sol is predisposed to act on men, whereas Merck vivus predisposed to act on women. This is the first thing that Nash mentions in his book Leaders in Homeopathic Therapeutics by himself. Then he goes on further to say that Mercor is mostly related to tenesmus. Now you need to understand tenesmus. And if you have understood Nux vomica pretty much well from the description that he has given, it's very easier for you to understand the tenesmus of Mercor. And what is the tenesmus? Tenesmus is nothing but something that is coming out but also giving an unsatisfactory feeling that makes you to have the urge again after a few minutes or few hours. So you are going to experience this type of presentation from the patients at some juncture of your practice. Once you understand what tenesmus is, it's going to be, a very easy prescription for you to give Merck core. So for Merck core, you should know that there is tenesmus of rectum and then there is tenesmus of bladder. You need to go again and again to pass the urine. When you need to go again and again to pass the stools. That is tenesmus. Never get well done feeling. Now the same thing is there in Nux vomica also, and Nash compares Merck core with Nux vomica also to some extent, but he says that for Nux vomica there is a temporary feeling of betterment, and if you understand this temporary feeling of betterment, this is going to clinch the diagnosis in favor of either remedy whenever you are thinking what to prescribe. The main problem, the practical problem of homeopaths, and this is what I always tell, the main problem of all homeopaths is to distinguish between one remedy and the other, and you don't know what should be the pointer to distinguish the one remedy from the other. For example, Merck core and Nux vomica, Nash compares these two remedies very closely, and he says that Nux vomica feels better after stool, whereas Merck core will always have the urge to pass again and again, again and again. That is what Merck core tenesmus is all about. Once you understand this, your job to prescribe either remedy becomes easier. Going further, he says that there is also tenesmus of bladder in Merck core, and this tenesmus of bladder is something like frequent urge to pass the urine again and again. Cantharis, capsicum, Nux vomica, Merck core are the other remedies which are vying for this slot of prescription whenever you have to decide on the remedy. So you have to understand the tenesmus, you have to understand the nature of Merck core or Merck sol in the patient, and then your job becomes easier to prescribe. The next remedy, the second remedy which Nash undertakes in the leaders in homeopathic therapeutics is Merck cynatus. Now, we all know the cyanide poison. We all know that cynatus is something that is going to kill someone, right? And if you want to understand what cynatus remedy Merck cynatus is, you just have to understand few cases which were cured by Merck cynatus as a remedy. There was a doctor in Switzerland. Nash mentions him as Dr. Beck, and there was a epidemic of diphtheria way back in 1900s or 1850s, and there was only 2% failure with this doctor amongst a lot of cases that he saw. All the cases were given Merck cynatus. Diphtheria is non-existent right now. We all know about it. There are vaccines available in plenty. They suppress the disease. But what you will see is that the sphere of action of Merck cynatus, it is the buccal cavity. So if you have a case which presents in the form of a lot of weakness, prostration is the cyanogen element. Nash says that there is this lot of prostration weakness. You seem to uh, indicate or give patient arsenic album, or you think that he requires carbovage, veratrum, but their weakness is at another level. Merck cynatus weakness, with the weakness there is throat symptoms, think of Merck cynatus, and also in chronic sore throat of public speakers, you can think of Merck cynatus. The third remedy which Nash mentions in leaders in homeopathic therapeutics, Nash, after the Merck cynatus, is Merck protoiodide. Now it's very strange for homeopaths to go through these remedy names and these unknown remedy names, but these were the frequently prescribed remedies by all the homeopaths back then. And today we are in an age where homeopaths are telling that we have some new remedy, we have some new rubric, or we have some, new way to practice. Stick to that, follow our method. This is what is happening everywhere, but we forget what Nash and our old authors gave. Merck protoiodide was given by him in all the cases where there was thickly coated yellow tongue at the base of the tongue, and used to be tips which used to be red, and it used to take the imprint of the tongue. This comes from the merc element. So it's a combination of antim and merc salt which you see. Other similar remedies what we see with merc iodide, protoiodide, is the natrum phos, which also has yellow tongue, Calibicromicum, and Chelidonium. But Chelidonium will have more of gastric symptoms. Merc protoiodide will have more of the sphere of action in the throat or respiratory passages. Next, again, like Merck Sinatus, Nash mentions that Merck protoiodide was the remedy he thought for giving to all the cases of diphtheria. Again, it's non-existent right now, but you will have some cases of throat pathologies. Think of Merck protoiodide, Merck sinatus, Merck core. In fact, I have given Merck core in many throat cases, in many urinary tract disturbances than other remedies like sulfur or cantharis. So you should know when to prescribe and how to prescribe. For Merck protoiodide diphtheria prescription, Nash mentions that it is similar to lycopodium, right to left. So in throat cases, pharyngitis, you have patient who has right to left complaint, think of Merck protoiodide. There will be fetid breath, there will be flabby tongue, thick yellowish coating, and you have recipe for Merck protoiodide. Now he says that I have been telling about the thick yellow tongue all through the remedy in Merck protoiodide, but it is interesting to note that it is not only the throat conditions where you will see that there is yellow tongue, but there is also stomach and liver troubles which will have these sorts of you know throat conditions. That is where you should know that it comes from that element of merc and protoiodide and all those things. So we finished three remedies from Nash, and the next remedy is a very big polycrest on which the whole foundation of homeopathy is based, and the remedy next he discusses is China officinalis. So China officinalis. Now these remedies are mentioned in pages like 8 to 10 pages. Nux vomica was mentioned in 8 to 10 pages, pulsatilla in 4 5 pages. But I have made it concise. I put it on PowerPoint. If you wish to see, all those who wish to see the PowerPoint, you can head to my YouTube channel, Alpesh Oza. You will see that the entire presentation which I am sharing on Instagram Live and YouTube Live simultaneously. On YouTube, it is there with the PowerPoint. Some salient features of the remedies are mentioned from Nash, which are very important. So we come to the remedy, which is China officinalis. Now, this is a remedy which has been used by homeopaths and allopaths. He goes on to mention, Nash mentions that this is remedy which is used by homeopaths as well as allopaths. Allopaths were using it for centuries, but they abused it very badly. And the reason they abused it was they gave it in the form of, for malarial people, like drugs, like quinine, and lot of weakness and debility in large doses, but they never got a chance to potentize. That's where our homeopath, Dr. Hahnemann, stepped in, potentized the medicines, and found it that it is to be given in all such conditions which have similar appearance of malaria, but with a different form of formulation than what the old school was giving. So we have China officinalis. Nash mentions Henneman, quotes Henneman saying that there is debility and other complaints after loss of blood or other fluids, particularly by nursing or salivation, bleeding, cupping, whites, or seminal emissions. And he mentions that I see patients along with these presentations, and also there is profuse suppuration with long continued diarrhea. So, all these are conditions which will make your body weak, and debility will definitely be there. This will give rise to faintness and ringing in the ears, and then you have the perfect ground for prescribing China. all the while when this is happening, you have chances to prescribe the other remedies. If the patient doesn't land in front of you in that phase, and he lands to you at the extreme end, where lot of things have happened with him, discharges have happened, weakness has happened, and he's almost on the verge of collapsing, that's where you should give China. So I urge everyone to go and read Nash Therapeutics, like the way he's mentioned. It's really beautiful. It's philosophy, it's materia medica, it's remedies, and it is reputations and potencies. Everything is there in one book in short, concise way. So what we see further is that Nash mentions for China officinalis, the remedy is good for gastric tract. We all know about it. But what is peculiar is that there is loss of appetite and canine hunger. Now it's interesting to see patient coming and telling us that I don't feel like eating, but the relative will tell us that no, no, he's telling you lies. He is eating in double quantity than he used to eat earlier. But the patient says that I don't have that appetite to eat. I'm just eating for the sake of eating. That's the contradiction that you will see in China officinalis. So Nash mentions that this is the symptom of China officinalis if you wish to prescribe. And Gunsi, who was one of the Henry Gunsi was one of the pioneers before Nash came. Nash quotes him and says that there is uncomfortable distension of the abdomen with a wish to belch up, as if a sensation in the abdomen was, there was packed feeling or fullness in the stomach, and it is relieved by, which is not relieved by erectation. So we always differentiate carbo veg and China with these two indications, which is whether they feel better by eructation, carbo-veg, not feeling better by eructation, which is China officinalis. So he says, going on further, he says that there is a kind of a slow digestion in China officinalis, and along with the slow digestion, there is lot of flatulence, lot of flatus, lot of passage of gas. And he says that in children, many homeopathic practitioners have this habit of abusing the child by giving lots and lots of doses of Sina because he is crying, he's not made comfortable by any position. And you observe the child and you say that he is probably not feeling better by carried, he does not want to stay with any one of them, in the relatives or father, mother. He just keeps on crying, and all the homeopaths are prescribing Sina. But Nash says that this is a condition for all the children. They are having lot of stools, good quantity of stools, but with the discharge of flatus. That is the ground for prescribing China officinalis. And the other remedy which Nash mentions to give in such conditions is calcarea phos. So don't abuse your patients with Sina. He mentions it very clearly. Lot of homeopaths are giving Sina on the basis of worm theory, which is totally useless because you just assume stuff, but you don't see the symptoms. If you see the symptoms, it is passage of large stools and lot of flatus which is passing. It's as simple as it gets. He keeps it really simple. Nash is one of the authors with whom you need to read again and again every year, something like every year, to give you the boost which you need in your practice from the practical point of view, and not something that is theoretical or philosophical. So going further, Nash says that if you want to prescribe China officinalis, you see that there is a disease which is having a periodicity, like a fever which keeps on coming at certain point of time again and again, or some symptom which keeps on happening after lunch, after dinner, or in the morning or in the afternoon. This periodicity needs to be kept in mind for prescribing China. So it's just not fever, or it's just not certain other condition which has this periodicity for China, but everything that is periodical in nature. And he mentions a case, a very beautiful case of inflammatory rheumatism, and you should go and read the case of inflammatory rheumatism from Nash, where he saw that this particular complaint is coming at certain time of the hour more often, and also there is kind of a you know disease which had traveled to the heart, and every other day aggravation was one of the peculiar things that he saw, and he prescribed China officinalis. So we try to make a lot of theories, and this is what Nash keeps it very simple for everyone to understand, that sometimes it's just the very subtle symptoms which the patient probably ignored and never told us, or did not feel the need to tell us. These are the symptoms which we should look out for and prescribe the remedies. So he comes to an end with China officinalis fever cases, and he mentions couple of fever cases, and he says that you know I started telling that allopaths and homeopaths both use China officinalis. They use in another form, we use in another form. But the advantage that the allopaths use quinine is that they make patients for homeopaths. And he goes on to describe that how quinine has been abused by allopathic doctors, and still it is going on the same state, and how we can prescribe China for those ailments from quinine and succeed in our practice. He mentions that if there is a patient who has chronic liver trouble, so you have to understand it can be fatty liver, it can be something that is of a chronic nature like liver cirrhosis, which is going on for a long time, and the patient may land into deep trouble later on. He tells that China officinalis is the remedy that you should start as an adjunct to the treatment which is going on, or it can be the sole remedy. And there is extreme sensitiveness with which he ends telling about China officinalis. This is also there in plumbum. This is also there in capsicum. He mentions a case of plumbum in China officinalis where there was post-diphtheritic paralysis and extreme sensitiveness was seen, and he cured the patient with plumbum. So in China officinalis, the only remedy not mentioned is not China, but he has mentioned about other remedies, the other relationships between China and other remedies. Like in periodicity, he has mentioned about natramur, he has mentioned about ipecac. These are the top remedies for periodicity as well. And he ends China officinalis by telling that this remedy is having extreme sensitiveness, and this remedy has the opposite symptom also, which is extra hard pressure ameliorates. So whenever you are examining patient, and I have found many patients who are very much uncomfortable when we are examining their abdomen, they feel very much awkward, or they make faces. That is the sensitivity that you can catch and prescribe China officinalis. But when you palpate deeper, you will see that there is hard pressure which ameliorates the patient, and you can confirm with the patient. You have perfect ground for prescribing China officinalis. The last remedy for the day which Nash says is carboveg. Now he mentions that I would say that trio of flatulence is carboveg, China, and lyco, and no doubt we agree that these are the remedies. But each of their presentation is different, and he mentions the comparison of how the three remedies are different. For example, for carboveg it is lot of flatulence or eructation which will ameliorate. For China it will never ameliorate, and for lyco it will have other symptoms which he goes on to mention in the lycopodium remedy, which will be the next remedy that we'll discuss. But what will be the recipe for carboveg? Now you will have a patient who is having lot of gastric symptoms lingering for a long time. He has some symptoms like lot of diarrhea, lot of discharge that has happened for a long time, and then there is a coldness of the body or lot of weakness, and he has landed at your clinic with last ray of hope, or you have been called to see a patient as a last ray of hope कि अभी तो हम आप पे ही depend है. That is the phase where you should think of carboveg. Other remedies which he says to be considered in such scenarios is arsenic and muriatic acid. Now, both these three remedies have their different indications, but For Carboveg, he says that it is this desperate condition of the patient or the physician which calls for a prescription of Carboveg. It's a desperate condition where you think that this is the last phase of the patient, and that's where you should think of prescribing Carboveg. He says that going further, many patients who have had asthma or other complaints since the time they had some other symptoms which is happened long back ago, I have prescribed Carboveg and improved a lot. So Nash gives you the confidence of how to prescribe Carboveg, how to prescribe China officinalis, and he says that all the patients will land to your doorstep with lot of flatulence. But what is the flatulence of Carboveg? Carboveg flatulence will be as soon as he goes to lie down, he will have lot of flatulence, he will have discomfort in sleeping, and there will be burning in the stomach. Upper abdomen complaints, Carboveg is indicated. And next, he goes on to tell that this burning in the stomach extends to the chest, and it's like a glowing coal. If you have been to coal engines, or if you have seen coal mines or coal which is burning, in those olden homes, village homes where coal was used as a fuel to prepare the food, you will see that how the coal burns. It kind of burns and gives you that flame. That type of expression is mentioned by Nash in his book for the burning of Carboveg. And once you understand that, you will be in a better position to prescribe Carboveg. Last but not the least, he ends with telling you that there is a typical hoarseness in Carboveg which happens from the damp weather. The hoarseness happens in the evening. This is the conditions or aggravation for Carboveg to prescribe. But if the hoarseness is more in the morning, you should think of giving causticum. This is what he says. Now he goes on to say that because of lot of gastric trouble for many days, some patients may also develop difficulty in breathing or bronchitis because of their immunity which is weakened. You can think of Carboveg or China. And in Carboveg, if you want to prescribe this remedy, if you are giving to any patient with bronchitis or lingering chest complaints like pneumonia like complaints, and you have given this patient antimtart, lot of weaknesses there, and the patient has not improved or has gradually improved, Nash says that you give a dose or two of Carboveg and the patient will definitely improve. So that's what he concludes the session, the Carboveg remedy, and he says that China and Carboveg are the two complementary remedies. They both complement the action of each other, and you will know these remedy better if you know how to prescribe, when to prescribe. So no need to go and scout for new methods, new remedies, new molecules, etc., etc. It's all there in our basic books. And today was day 2 of reading Nash Therapeutics, some summaries, some interesting learnings from Nash Therapeutics, 5 remedies that we did. And I hope it is helping you all. If there is anything that you need me to answer, please drop in the comments below, and I'll surely make sure that we answer in the best possible, earliest way. That's what we come to an end from today's session, and we'll meet up again tomorrow with the next 3 remedies. The first remedy that we'll discuss tomorrow is lycopodium, one of the frequently used and abused remedies by all homeopaths. Very funny but very interesting. So thank you all for joining, and good to see some people who are glued till the end. Like I don't know the names who stayed till the end. You can't see the names, but good to see many people today. And uh, M.A. Lahiri 15, remedy for patient feeling as if under control. You can think of stemonium, you can think of superhuman control है तो है ना काली बाई ब्रोमैट हम सोच सकते हैं क्योंकि उसको लगता है कि वो हमेशा उसी डिवाइन चीज के अंडर कंट्रोल में है. This can be like out of the box thinking. but if it helps you, you can study both these remedies, stemmonium and kali brome, and maybe you will find something. So that's what we come to an end from today's session, and I hope it was a good study time for everyone.